Hi everyone. So I'm going to be doing this is going to be a fairly brief webinar. I'm just going to be going over a product that is fairly new, and it's pretty breakthrough as far as helping the body heal itself from pain. And pain is a pretty big issue. Obviously, I'm a healthcare provider doing network spinal analysis and wellness chiropractic care. And a lot of times people come to our office because of pain. And I always tell people we're not trying to treat their pain, and sometimes it can be a very bothersome thing. And I know people that have been going to chiropractors regularly, but there might be still something that's lagging or some sort of issue, even though they're getting the wellness care and getting a lot of great benefits. And I have people like this too. There might still be something that's just sticking around and still lagging, and it's still bothering them. And I've always been sort of interested in helping the body heal from the inside. And so don't take this as something that's replacing proper spinal care, because it doesn't, and I'll show you why that is. But just think of this as a supplementary thing that you can do to actually help your body heal from the inside. So I'm just going to go to share my screen, and you'll see what I'm talking about, and we'll get through the information. Okay. So this is the first time doing this, so hopefully everything will go good from this point on. So I'm introducing a new product, and this is natural pain-free healing from the inside out. So just as a warning, even though I will be discussing a breakthrough in helping your body handle pain naturally, I want you to understand that it does not replace proper spine and nerve system health, and you can only get that from going to a chiropractor regularly. And hopefully people around the world will be seeing this. So obviously I have people in my office, which this is useful for as well, but I'm hoping that other people around the world will get this message, because this product is available anywhere. So just as an example, just to show you how to look at this in the right context. So hopefully you can see my little cursor here. This is a very common condition that we see in our offices called forward head carriage. So as people's spines have been what we call grown up subluxated, so they've had little errors in their spine as they've been growing, the head actually starts to go forward. And what happens is that's going to start to put a lot of stress, and will actually start to decay and degenerate and accelerate the decay and degeneration in the spine. So this lady, maybe she's suffering from headaches or neck pain, or it could be even back pain down here. 70 or 80% of low back pain actually comes from the fact that your head has gone forward. So just all of this happens, and it usually starts from birth. So just as the process of being born, it's very often that they pull on the baby's head to pull him out of mom. And just the fact of coming out of the through the birth process can be very traumatic for the spine, and a lot of adult problems start in youth. So let's say this lady here is suffering from neck pain. If she takes this product that I'm about to talk about and quote unquote her pain goes away, would that have corrected her problem? I hope you can see that that will not. So she, as well as taking this product, which might help her with her pain, she actually needs to get regular corrective care, and her spine needs to be maintained just like you maintain your teeth. It's the same idea. So just think of chiropractic as spinal hygiene, just like you think of oral hygiene. You don't just go to the dentist when your teeth hurt. You to go regularly to get them clean. So you should be doing the same with your chiropractor. So once again, don't take this as an alternative to getting proper chiropractic care. This is just something you can add into your process. Okay, so let's look at this. So we're going to be talking about what people usually do for their pain. For the most part, one of the most deadly common pain medications on the market. If you're taking the silent killer, you could be subjecting yourself to a 340% increased risk of heart attack or stroke. The scientific discovery made in 1972, which gave a scientific explanation as to why you experience more pain as you age. This is important. So it will also how you can easily and quickly fix this problem without resorting to drugs or surgery. We'll also be going over the 12 most powerful and safest anti-pain ingredients, which is also part of this product. Okay. So just to be talking about the side effects of drugs, I'm not going to harp on this too much, but it's a very important thing, because just people are just taking these drugs thinking that they're safe and they're not going to cause any problems, and a lot of people really don't know what kind of damage is coming from this. So for years and even decades, we've been told that if you have pain, just taking something like an Advil, a Aleve, Celebrex, whatever, Motrin, the list goes on, that's fine. So if you're not a fan of living, that's great. Okay, while these drugs may be working right now to temporarily stop your pain, they are secretly working behind the scenes, tearing apart your stomach, turning your organs to mush, and causing your insides to become leaky faucets of blood. Okay? Don't believe me? Here's some proof. Adverse drug reactions are the fourth leading cause of death in the United States, and even putting your life at risk in the hospital, affecting more than 1 in 10 patients. So only heart disease, cancer, and strokes kill more Americans every year than drug reactions. So here's just a handful of examples, commonly prescribed pain meds and the health-crushing effects that they can cause. Aspirin, super common. You can double your chances of developing a perforated ulcer or gastrointestinal bleeding. And start taking 1-a-day aspirin and kiss your organs goodbye. Tylenol and acetaminophen. Every year, more than 56,000 Americans will visit the emergency room due to acetaminophen overdoses. It's the leading cause of calls to poison control centers and by far the leading cause of acute liver failure, causing more than 50% of all cases. And if any of you have seen or know of my workshops on ADHD and autism, this is a very, very important thing, as it causes a lot of problems with your body's super antioxidant, glutathione. And it's a very, very important issue. So, try to avoid that as much as you can, especially if you're pregnant, or if you just try to avoid that with your kids as well. So Vicodin, Lorcet, Norco, Percocet, all these really heavy ones here, oxycodone, etc. 16,000 people every year die from opiate overdoses. Okay, highly addictive, etc. Advil, Aleve, ibuprofen, naproxen, the everyday pain meds carry a heavy burden, much heavier than you would expect. The odds of dying from taking a non-steroidal anti-inflammatory drug after just 2 months is around 1 in 1,200. Ouch. So the longer you use traditional pain meds, the less effective they become. Many of today's most popular pain medications like aspirin, ibuprofen, etc. are designed to fight inflammation. Great. We know that inflammation is basically the big cause of pain. But others like Tylenol and Panadol block the pain signals. So none of them target what might actually be at the root of your pain, which is fibrin. Now this is an important thing. Fibrin is a natural substance in your body which helps in wound healing. It's also what scar tissue and scabs are made of. So here's how this works. Your body senses an injury, let's say you step on a nail or you get cut or whatever. It can be a minor, small bump or scratch, whatever it is. So it sends white blood cells to the area of irritation or injury to fight infection, causing inflammation and swelling, because you don't know what's, maybe you got like bacteria or something into an open wound and your body has to send white blood cells there to attack whatever's there. Then fibrin is released, essentially to seal off the site. Okay, it's like a big webbing that just kind of goes around the site to wall it off so that your body can kind of handle it in a specific secure area. Normally, when the site is healed, the fibrin breaks down and the inflammation subsides and everything goes back to normal. This process goes haywire often, causing spiderwebs of scar tissue to pump through your body. Sometimes our bodies fail to cut off this fibrin. So like a button that's stuck in the on position, fibrin continues to build up around the site and then hardening, causing further inflammation and more excruciating pain that just won't go away. So it just kind of gets like a spider web that just becomes chronic and stuck there. Recent studies show that if you're over 50, once the inflammation is triggered, it's much less likely to go back down. So you keep tossing all the painkillers at the fibrin, but it's like trying to break a walnut shell with a water gun. In this case, all the painkillers in the world won't work if they can't get through the fibrin to get to the area. So the longer you ignore the real cause of the problem, the fibrin, the longer you're going to stay in pain with the less effective traditional pain meds will be in managing your pain, basically. So we've discovered a way to bust through the fibrin, lower inflammation, and free your body from pain from the inside. So it starts back in time a bit with a guy named Dr. Max Wolf, who's a medical doctor at Columbia University over 30 years, and he was doing research on why your pain seems to increase as you age. In particular, he was looking for the differences in why young people experience faster healing times and less overall pain than older folks. And here's what he found. When the body was reacting to pain, the bodies of younger adults responded by flooding the painful area with something called proteolytic enzymes. But for some reason, the older folk studied showed dramatically reduced levels of these enzymes and therefore felt more pain. So he's excited by this discovery. He narrowed it down even further and discovered that beginning around age 27, the amount of proteolytic enzymes in your body starts to go down. So the bottom line is if you're older than 27, this may be the reason you're still in pain. So could these proteolytic enzymes be acting as the shutoff switch for pain? Dr. Wolf's discovery that younger adults have dramatically higher levels of proteolytic enzymes in their bodies launched a wave of controversy and excitement into the scientific community. And what the scientists found was nothing short of amazing. In 1972, they discovered that proteolytic enzymes are the first line of defense against pain and inflammation. So they also discovered that proteolytic enzymes are completely safe. In 1993, scientists discovered that these enzymes have no lethal dose. Compare that to non-steroidal drugs, which put hundreds of thousands of people a year in the hospital and in some cases even cause death. In 1982, proteolytic enzymes showed that they eat fibrin and other scar tissue. This may explain why, as you age, your wounds heal with thicker, weaker, less pliable, and more visible scars. That's because you don't have enough proteolytic enzymes to kind of eat up the scar tissue. So basically, your wound healing gets sort of less efficient as you go, and so the wounds kind of just keep staying there. So these enzymes also cleanse toxins from the blood. So believe it or not, cells and organs dispose of toxins through your blood, and the proteolytic enzymes soak these up and get rid of them. Your blood becomes thick from too much scar tissue, which turns it into kind of like a sludge, causing a high blood pressure, lack of circulation, clots, and obviously lack of oxygen to specific tissues too, which can eventually cause organ dysfunction, etc. So the proteolytic enzymes help clean the blood and make it flow better. These enzymes also fight viruses and improve your immune system. Proteolytic enzymes recognize viruses through their special lock and key mechanism, just like they recognize the prostaglandins, so you get sick less often. These enzymes also have been used in Europe since 1974 to treat cold sores and other viral conditions. That's even before people knew what they were called. So, an all-natural, 100% safe, pain-relieving supplement which heals your body as it soothes away your pain. So I'm going to hide the name of it for a little while so people don't go off searching for what it is. Okay? So it not only gives you the healing power proteolytic enzymes in a convenient capsule, but it also goes where no other proteolytic supplement has or will. Today's most powerful proteolytic enzyme combination. So what they've done is they've put together proteases, protease 6, alkaline protease, bromelain, which comes from pineapples, etc., papain, etc., to give you the most powerful pain-fighting effects. And what the thing I like about it is what's on the label is what's there. Okay, and this is the only true all-natural proteolytic enzyme formulation. There's no fillers or no preservatives, etc. So the guys that produce this are really quite top-notch, and they're very, very ethical in their packaging. So, as well as the enzymes, there's 12 other proven anti-inflammatories straight from sort of like Mother Nature's garden sort of thing. So these are 12 other things that are also included in this package, because there's a lot of other I'm going to call it natural painkillers that have some of these 12 things, but that's all they have, but they're actually missing the whole proteolytic enzyme factor. But these are the 12 things that are also in it. So turmeric is in it, papain is in it. I'm not going to go through all the definitions here, the explanations. You'll be able to read it on the site later. Devil's claw root is very common, boswellia extract, vitamin E, ginger extract, gluten, which is the part around the outside of the orange, is the white part, which most people kind of take off, but you should be eating that part too. Citrus bioflavonoids, very important. Glutathione, which I mentioned before. Mojave yucca root. So here are just a few of the testimonials. Okay, so the mama 4 ditches her liver-damaging Celebrex for this product and loves the results. This is what she said. I had orthopedic problems since I was 7 years old. I figured up that over the last 31 years, I'm 38 now, I've had a total of 14 surgeries, 6 of them knee surgery and 1 foot surgery, plus a broken pelvis and sprained SI joint from the past car accident. After the foot surgery 10 years ago, the doctor decided I would benefit from taking Celebrex. Recently, after being diagnosed with severe arthritis in one knee and moderate arthritis in my foot, the doctor doubled my dosage of Celebrex. I couldn't discern any improvement on the knee dosage. Also, I began getting concerned about the possibility of the prolonged usage of this drug causing liver damage. So I've been taking this product now for 30 days and I feel the same as I did while taking the double dosage of Celebrex. I have hope that after more time on this product, I will feel even better. And I like the fact that right now I'm getting at least the same, if not yet better, anti-inflammatory effect from these natural enzymes rather than from a chemical that could potentially harm my liver. Nice. So, more relief from this than I got from naproxen. I'm a registered nurse working 12-hour night shifts and I have fibromyalgia. I take Lyrica 3 times a day. I received a bottle of this product as I was leaving for work tonight. Was aching all over. I was going to take some naproxen, but on opening the envelope, I decided to take this instead. It's approximately 4 hours later, and I got more relief from this than I had from my naproxen. Not bad for the first dose. I'm very hopeful. So I like this one. This comes from a pharmacist. I've taken a keen interest in natural supplements. I can safely say I've seen it all. But for patients with pain who are looking for an answer outside of the dangerous prescription medications, I've only found a handful of recommendations. This product is on that short list. It's not only as effective as the prescription anti-inflammatories, but it's much safer. And unlike other supplements on the market, it really is free of any fillers and colorants, etc. It's all natural. The point is, if you're sitting on the fence about other options to treat your pain, you owe it to yourself to give this a try. And it is guaranteed to work for you, or they give you your money back. So they guarantee that if it reduces your pain, you have you feeling better, or they're willing to refund your money. Okay, they can try it risk-free. So it heals your problem instead of just covering it up. So unlike traditional pain meds which simply cover up your pain like a Band-Aid, this product actually heals the underlying condition causing your pain. That means that you'll feel quick pain relief in the short term and permanent healing in the long term. No side effects because, once again, proteolytic enzymes are part of your body. It's just that they decrease over time, and replacing them will actually help your healing process. Okay, so that's the seminar, the webinar for tonight. So this is the next step. So you can go check this out on your own and make your own decisions about it and decide what to do. So this is the website you need to go to. You're going to go to http://goo.gl/i_OLTR_P. When you're going through the product, if you like what you see, whatever, if you're going to order it, you can insert the code with all capital letters, save 10 today with no spaces at the checkout, and that will actually help you. That's a special discount that I got with the company so that I could offer that to the people on this webinar. Okay, so that is the webinar. I'm going to leave this page on for a little while so you can type in the website correctly and go to see it. On that page, you'll see another sales page with a lot of the same information I just went through. And hopefully that will be helpful for you. So I'm going to leave this on for another few minutes. All right, that was it. Hopefully that was helpful for you. Any questions, you can send an email to my office at info@networkfamilycarecenter.com. And that's the webinar. So hopefully you'll enjoy the product. Like I say, I've had some clients with some pretty severe situations with some bad discs, and I told them to get on this as quick as they could, and they've had some good effects. So just give it a try, money back guarantee. And once again, I like the company and I like the products that they make. So go ahead and have a look at that. All right.